So I'm going to be talking about the otoscope. So the three main things that you can examine with the otoscope is the ear, the nose, and the mouth. So the first one I'm going to talk about is the nose. So the first thing that you're going to do is you're going to inspect and palpate. So you're going to look for any deformities, anything along those lines, any pain, like any tender toe palpation, anything along those lines, any obvious deformity, like any shift in the nose or anything. Then to examine the nose, you'd use the otoscope. You'd push upward on the patient's nose, and you'd look inside one nostril at a time. Know any cuts / serrations inside the nose, any signs of infection like rhinitis. You can see a deviated septum if there's one. Let me think. Know any abnormal fluid like cerebrospinal fluid. That's basically it. You can notice any fractures or anything along those lines, like the plate fracture, anything. So the next thing that you can examine would be the ear. So just like the nose, you'd examine and palpate first. So you'd palpate the entire ear, know any tender toe palpation, any abnormal feelings like excessive fluid, like with cauliflower ear. And then you could examine inside. So in order to see the tympanic membrane and the ear canal, you would pull upwards and tilt, and you'd look inside. You go just past the hairs, and then you could would usually have not an amazing picture, but you could see pretty clearly. So you want to look to see if the tympanic membrane is typically a grayish color. If it's pink, it's alright. Typically you want to see like a grayish color. Know any foreign bodies, any fluid or anything. If they have an ear infection, typically it'll be like almost like a fluid, bubbly substance kind of. So know anything like that. Any cuts, anything along those lines. And yeah. And then the next thing that you can examine is the mouth. So just like before, you want to palpate and examine, know any cuts, lacerations, any obvious deformities, anything along those lines. You want to examine the lips and the vermilion border before you have them open their mouth. So when you have them open their mouth, you want to examine their teeth, their gums, their tongue, their palates, anything along those lines. And then when you have them say ah, you want to look in the back of their throat, at their uvula, where the tonsils are and everything. Notice any signs of infection, any swelling, or anything along those lines. Also, when you're palpating, you want to palpate the neck. You want to palpate the parotid glands, the lymph nodes, and all those things. And yeah, that's how you would use the otoscope.